first I would like to ask you both permission to use this video for educational purpose and on internet.
Sure.
Do you have your permission?
Yes.
Good. Now, first of all, I see you are in a wheelchair and the walking getting really difficult. Is that correct?
Yes.
Now, if I just hear that and turn around and look at this picture, my knee-jerk reflex is I want to take you to surgery right away and fix that. That's my knee-jerk reflex. You're just not able to walk, and I look at that picture, and I want to go and fix that. But this video is about that is not your problem. And I'm going to look around. You know, this is not a trivial problem. Look at that, how this is collapsed, and you have but as well syrinx, and it's bending and twisting all the wrong way. I'm going to bring few other pictures here. Look at that, how bone is twisting and bending all the wrong ways. So tell me, what is going on there? Tell me your story about your accident that you had many, many years ago.
I had a motorcycle type accident, and the last thing I remember is laying on the ground. And I think I landed like this.
Yeah, you broke your back pretty. Broke your back pretty bad.
Yes.
But that did not happen just recently.
No.
When did that happen?
1975.
Many, many years ago.
Yes.
Like almost like 40, 50 years ago.
Yes.
How old were you?
12.
12.
We're just going to be 12.
Do you know what the amazing part is? That after that accident, you healed.
Yes.
And you are functional. I give you, you're a farmer, right?
Yes.
So farmers are like unbelievable. Like, you know, there's a joke among doctors. If a farmer complains a little, start running. Meaning that the problem is serious.
Yeah, that's true.
Okay?
Yeah.
So, but you went on for 35 years after that, and then you had additional problem, and then you went to a major hospital in Minnesota. We don't want to call it name,
And then
but
they
then
found that syrinx.
they found that problem, and they found the syrinx, and they put a shunt in the syrinx, and then it was experienced surgeon. He didn't want to do anything about that. Is that correct? No, the oldest one, the first one.
Well, there was one before that.
Yeah, one before that.
Before he was just a young one, and he wanted to fix it too. But then in the meantime, I asked the neurosurgeon, I said, should we get a second opinion? And he said, yes. He said, I got a surgeon in Rochester. He said, I'll set you up right away. Well, then we went to him, and he's the one that said, well, he said, let's just watch it. He said,
monitor it.
Okay, let's watch it.
Yep.
Even though it was bad then, probably as bad as now, he said he watched it.
Just monitor it.
He was a very experienced surgeon. He looked at you and said that your symptoms are not related to this. Why take a big risk? And this is what about fixing patient, not fixing patient, not fixing pictures. Fixing your symptoms.
He'd take an X-ray, and then he'd see if there's any drastic change.
Yeah,
the angle
monitor it.
Yeah.
as you get older.
And he said it was stable all the time.
Yeah, and that would be exactly what I would do.
Okay.
That I would watch it. If you're not symptomatic, doesn't matter how bad this look like, as long as you don't have associated symptoms with that, watch it and observe it, monitor it. So he was an experienced surgeon. Don't say name, but there was another younger surgeon who wanted to go and fix it. Tell me about that.
Yeah, he was set up to go an appointment every 6 months or a year. And then the original surgeon said, leave it. He had left, so this one took his place. And we got to get ready to fix that, he said.
Because the angles are bad.
Yeah.
Because the angles are bad, let's go fix the angles.
And I was complaining of pain in my lower
we kept
back.
complaining about lower back, and well, don't worry about that. And I said, have you looked at it?
But the lower back is not where that broken bone is. The broken back is the actual mid back.
No.
So he
said,
looked at the picture, dismissed the lower back. He wanted to go and fix this angle here.
He said, we'll fix the lower back when we do the upper part. He said,
Oh,
that's what he
okay.
said.
So that is how he wanted to do it, practically from neck down to pelvis, fix everything. And
Yeah, that's what he wanted.
did he tell you what the risk associated with that surgery
He
was?
said you could leave you paralyzed, he said.
Yes. So you could walk, you didn't have associated symptom with that, but because he wanted to fix the angles there, he wanted to do neck to pelvis.
Exactly.
The associated risk with those kind of surgeries are reported 40 to 60%. So that is a big surgery.
That's what he said. It might take, how many hours was he talking to do
20
that?
hours.
20 hours.
Or plus.
Yeah.
20
Well,
hours plus.
I wouldn't do that
No, I didn't.
because I fix patient, not pictures. And
That's right.
but
I agree with you.
but it doesn't matter. You do have some symptoms that are new.
Oh, yeah.
So this happened almost 50 years ago. You were functional, you were a farmer, you were working hard, and you were getting by. But 4 years ago, you start having symptoms.
Yes.
And I'm
He
going.
actually started a little bit earlier than that, but, you know, you were still getting around. And
But let me show you what the problem is now. I'm turning around. This is an old problem that is not your current problem. Your current problem is actually here. You have L5S1 grade.
What caused that problem?
You know, part of that is getting old. Part of that is your spine is, is unphysiologic.
Right.
Part of that is you are a farmer. You abuse your back a lot.
Did a lot of lifting.
Yes, you did. But coming back to that, all your symptoms correspond to this.
Yes.
And that is exactly what this meeting is about. You see, you have what we call L5S1 grade 2 spondylolisthesis. And most of your symptoms correspond to this. And in my opinion, that's the only thing we need to fix. Okay? This is the only thing we need to fix, and that would give you enough improvement. Instead of from neck down, 60% complication rate and give you a chance of being paralyzed. I think that is the idea here, is that not everything that look bad on the films need fixing. Otherwise, if you want to fix the films, go do Photoshop on the computer, fix it on the computer, right?
Right.
Yeah.
Okay.
Well,
Now,
I mean, you don't break something that isn't broke.
Yeah.
If it's working, you leave it alone.
how many machines in the farm do you have that are not perfect, but they don't need fixing?
Exactly.
Now take the engine apart and try to fix things. That is sometimes the best intention, which cause more harm than good by trying to overdo it.
You can.
Yeah,
You really
and
can.
it's not unusual. I mean, I'm sure that doctor had best intentions, but it's not unusual, especially younger surgeon. They come to the realization that sometimes the actual helping the patient requires not to take the risks,
Okay.
not to do big surgeries and so on. So this surgery we are going to do for you, we are going to fix you, but not that what happened 30 years ago. The bottom one that corresponds to your symptoms, that surgery is 40-minute procedure the way we do it, and you may not even stay in the hospital.
Okay.
Okay, may go home same day.
Okay.
With 1/10 of the blood loss, 1/20 risk of infection, just that one level that need fixing that correspond to your symptoms. Okay.
Okay.
Okay. Well,
Okay.
any comment? Any question?
Not really.
Okay. Well, thank you for the interview. I appreciate that.
You're the first guy that's went this thoroughly with us.
Oh, well, I'm happy to hear that. But I think it is.
When they talked about the big surgery and cutting you, I always thought about the new technologies.
The keyhole surgery.
Yeah.
No, that big surgery, if we truly were going to fix the numbers there, you have to do that big surgery to correct those numbers.
Okay.
The small surgery cannot correct the numbers.
Right.
But then you have to decide, do we want to fix the numbers or do you want to fix you?
Or can you, if something's bothering, can you tweak something in there without straightening it?
And well, that is exactly the point,
I mean,
Can we fix the
is there something, if
symptoms?
something pinches, can you
Yes, we still can.
Change it
But then we
without
cannot
doing-
correct the numbers.
Right.
Okay.
right.
Yeah.
You can't
To
fix
correct
it.
the numbers, we have to do that VAC surgery from
Yeah.
neck down to
Yeah,
pelvis.
yep.
Okay, that's the only way to
understand.
fix that numbers.
Yeah.
Anything else we can, limited
you can
way,
find something, you can tweak it and fix it.
Right.
but then the numbers all stay the same.
Right.
And
Right.
again, it comes back to that we have to decide eventually fix the numbers or fix you. I choose fixing you anytime to fixing those numbers.
Yeah.
Okay?
Sounds good.
Well, thank you so much for the interview. I appreciate it.